Yes, ma'am. Start the class.
Okay. So good evening, everyone. Myself, Dr. Aanchal, and we have started the series of 8 classes of GI track, in which today's topic is esophagus, and we are going to learn about the basic morphology and functioning of esophagus, and also we will discuss the stages of swallowing, that is also known as deglutition. So, firstly, I'm going to discuss with you the core features of Oracle. First, we have the live classes in which you will get the one-to-one interaction with the faculty, and which obviously elevate your learnings and skills. Then the recording classes are also available on Oracle, in which the student can has the access anytime, anywhere through the recorded sessions also. Then we also provide the ultimate comprehensive books with CBME based question answers, MCQs, and full zone assessment for the students also. Then also in the Oracle, we have MCQ, which basically from beginner level to the expert level, in which you will get the standard MCQ questions. Then you can also book a slot for personalized counseling session, in which you can you can have the interaction, one-to-one interaction with the counselor. Now talking about the some subscription plan that we have on Oracle. So we have basic 3-month plan, standard 6-month plan, premium 12-month plan. So basic 3-month plan starts from 15,000, in which you will get pre-recorded class access and live classes, and also you will get quick revision examination module. But in standard plan, which is of 6 months, you will get pre-recorded classes, live session, live doubt clarification, quick revision examination module. And for premium 12-month, which is of 50,000, you will get all the feature of Oracle, like pre-recorded classes, live session, live doubt clarification, one-to-one personalized guidance, notes, quick revision and examination module. So personally, I will recommend all the student to take premium 12-month subscription, so that you will get all the very important features that has been added by the Oracle. For 20% discount, you can add or you can use my code, that is Aanchal 20. Then till now, as we have started the series of GIT, so first lecture was on introduction to GIT, second we have covered over the saliva, and third in today lecture we are having on esophagus. So on 26th February, I'm going to cover or take stomach. 28 we will have liver. Then 3rd March we will have lecture on pancreas. 4th March I will take some small intestine, and on 6th March I will take large intestine. So now starting with the today's topic, that is deglutition. So here we have a clinical case scenario also. So this clinical case scenario I'm going to discuss with you in the last of the class. So now talking about the deglutition is also known as swallowing. So as we know that in mouth we have tongue, saliva, we have teeth. So basically tongue help in the tongue, both tongue and teeth help in the chewing of food. Okay, so that is also known as mastication. So basically what is mastication? Mastication is the first mechanical process of GI tract by which the food substances are turned or cut into smaller particles and crushed or ground into a soft bolus. So basically the chewing is a very important process that is done before swallowing, so that the basically the food can be made more slippery, more easier way, so that the swallowing can be done easily. In mastication, basically what are the significances of mastication? So first we have the breakdown of foodstuffs into smaller particles. So basically the chewing obviously is done so that the food particles are broken down into small particles. Then also the mixing of saliva with food substances also occur in this process. So obviously saliva, as we discussed in the last class also, that saliva make the food more soften, more slippery, so that the process of swallowing can be done easily and in a proper manner. Then the lubrication and moistening of dry fruit by saliva, so that the bolus can be easily swallowed. Then appreciation of taste of the food can be also done in the mouth with the help of the taste buds which are present over the tongue. Now, talking about the muscles and the movement of mastication. So, as we know, there are four muscles which are involved in the process of mastication. First, we have masseter. Second is temporal. Third is pterygoid, and fourth is buccinator. So, all the muscles except masseter are innervated by the seventh cranial nerve, that is facial nerve. Only masseter is innervated by mandibular division of trigeminal nerve. Now talking about the different role of these muscles. So basically, the masseter is responsible for raising the mandible, and also it clenches the teeth and help to protect the mandible. Then talking about the temporalis, which is also innervated by facial nerve. So basically, it raises the mandible and retracts the mandible after protraction. Then internal and external pterygoid muscles protrudes the mandible and depresses the chin, therefore help in the opening of mouth. Then the last muscle that we have, the buccinator, which is also the muscle of mastication. It is the accessory muscle of mastication which prevents accumulation of food between the cheek and teeth. Okay, in the absence of these muscles, obviously there will be accumulation of food between cheek and teeth. So this is a very important muscle, and that's why it is also known as accessory muscles of mastication. Then talking about today's topic, that we have deglutition. So as we have discussed, the deglutition is also known as swallowing. So basically it is the process by which the food is masticated and move from mouth into stomach through two structure. The first we have pharynx and the second we have esophagus. So in the diagram also, as we can see, in the mouth we have soft palate, we have tongue, then we have hard palate also, hair and epiglottis, and these structure we are going to discuss in further slides. So now talking about these stages. So first stage we have the oral stage. Second stage we have pharyngeal stage, and third stage we have esophageal stage. So a very important thing I wanted to discuss with you, that oral stage is the voluntary stage, because in oral stage we have the control over the mouth, so that whenever the food will come inside the mouth, so we have the access, either we want to swallow it or not. But once the oral stage is over, then the pharyngeal and esophageal stage both are involuntary, because the access will not be in our own hand, because whenever the food will reach inside the pharynx, so it need to be swallowed anyhow. So basically, the oral stage is voluntary, and both pharyngeal and esophageal stage is involuntary in control. So basically, chewing action of the teeth and the movement of lower jaw against the upper jaw is brought by the muscles of mastication, as we have already discussed. But an important thing, that basically all this center is basically controlled by the very important nerve, that is 10th cranial nerve, that is vagus nerve. Now, talking about all these stages in detail. So as we can see, we have four diagrams. So first we have this stage is known as pupillary position. Then we have oral stage. Then we have pharyngeal stage. Then we have esophageal stage. So looking at the diagram, as we have soft palate, then hard palate, then bolus. So here the bolus is present on the dorsal surface of the tongue, as we can see. Then we have epiglottis, glottis, upper esophageal sphincter, and lower down in the lower part of the esophagus, we have another sphincter that is known as lower esophageal sphincter, which guarded whenever it get relaxed. So with the help of this sphincter, whenever the sphincter get open, the food will move from esophagus into the stomach. Now discussing the first stage, that is known as pupillary position. So basically, this is particularly not a stage, but this is a position in which the food is now ready to get swallowed inside the pharynx. So basically, oral stage is the stage from where the food will move from mouth to pharynx, and the pharyngeal stage is the stage from which the food will move from pharynx to esophagus, and the esophageal stage is the stage in which the food will move from esophagus to stomach. Now talking about the very important stage, the first stage, that is known as oral stage. So basically what happened? The oral stage of deglutition is voluntary stage. In this stage, the bolus move from, or it passes from mouth into pharynx by a series of action which are very important, and we're going to discuss the series in detail. So as we can see, here we have the soft palate, here we have the hard palate. This is the dorsal surface of tongue. This is anterior part of tongue, and this is posterior part of the tongue. So these structure plays a very significant or important role in the first stage, that is oral stage. So basically what will happen whenever there will be and retraction and depression in the anterior part of tongue. So what will happen? The posterior part of tongue will get elevated and retracted against this hard palate. So this pushes the bolus backward into the pharynx. So this is how the food will get move inside the pharynx. I hope this is clear to you. So basically, whenever the bolus is placed over this dorsal surface of the tongue, so basically, as we have discussed, this is known as the pipiratory position. So whenever the interior part of tongue is retracted, this is the interior part of tongue, okay? So whenever the interior part of tongue is retracted and depressed, so the posterior part of the tongue will be elevated and retracted against this hard palate, and this pushes the bolus backward into the pharynx. So the forceful contraction of tongue against the palate produces a positive pressure in the posterior part of the oral cavity. So in this way, the food pushes itself into the pharynx. So in this way, the food will came into this structure that is known as pharynx. I hope this is clear to all. So basically what happened, again, I'm discussing you this thing. So basically what happened after mastication, food is chewed and moistened and lubricated by saliva, is rolled into a bolus form by the movement of cheek and tongue. The bolus come in to lie in the curve of the tongue, as we have seen in the pipiratory position. Now the contraction of the first part of the tongue presses the bolus against the hard palate, as we have discussed the functioning of the anterior part and the posterior part. So while a series of movement that we have discussed of the middle part push it to the back and forcing it to the pharynx. So I hope this is clear to you all. Now, basically, as we have discussed this, the action of series. So in the oral stage, now the food has moved from oral cavity or buccal cavity into the pharynx. Now we have second stage in which the food will move from pharynx into the esophagus. Now we have to see how this will happen. So basically the pharyngeal stage, again, it is an involuntary stage. In this stage, the bolus is pushed, as we have discussed, from pharynx into the esophagus. Now, as we know, the property of pharynx, the pharynx is a common passage for both air and food. For both air and food. So basically, as we can see, it is divide into larynx and esophagus. Now, larynx lies anteriorly and continuous as the respiratory process. As we can see in the diagram also, here we have the voice box that is also known as larynx and is continuous as the respiratory passage. Now, esophagus lies behind the larynx. As we can see in the structure, this is, we have this structure, we have esophagus. So basically, continuous as GI tract, since pharynx communicate with mouth, nose, larynx, and esophagus. So as we can see here, this structure, this opening is also known as nasopharynx. here we have the mouth cavity, oral cavity. Here we have the larynx, the voice box, and this is continuous with the respiratory passage. And here we have the esophagus. So now we can see whenever the food is present inside the pharynx, so it has four pathways. So means it can enter into the nasal cavity also, it can enter in the mouth, it can enter in the respiratory passage also, or in the larynx, or it can enter in the esophagus also. So obviously, the food needs to move into the interrogatory direction, means into the esophagus. So now we're going to discuss that what are those structure which are present into this nasopharynx, into this mouth, and into this air passage, which basically prevent the movement of food into these pathways, because obviously the food needs to swallow it from pharynx into the esophagus. So one by one we're going to discuss those things. Okay, so first we have the mouth. Yes. So basically the pharyngeal stage is an involuntary stage. In this stage, the bolus is pushed from pharynx into esophagus. Pharynx is a common passage for food and air. It divides into larynx and esophagus. The larynx lies anteriorly and continuous as a respiratory passage. Esophagus lies behind the larynx and continuous as GI tract, since the pharynx communicate with mouth, nose, larynx, and esophagus. So during this stage of deglutition, the bolus from the pharynx can enter into the bolus. Now we're going to discuss those structure which prevent the entry of food from pharynx into mouth, into larynx, and into nasal cavity. One by one we're going to discuss. So in the mouth, basically in the mouth, we have the position of tongue which is presented in such a way so that the food cannot return from pharynx back into the mouth. So basically the position of tongue against the soft palate is present in that way so that there will be a close structure, right? So which will prevent the entry of food from pharynx back into the mouth. Again, another thing, that there is a presence of high intraoral pressure also that is developed by the movement of tongue, so that due to this pressure, the food will not be able to get back into the mouth. Next, we have the nasopharynx. So basically for nasopharynx, we have a very important structure, which is basically formed by the extension or elevation of soft palate, that is known as vulva. So this structure is responsible for preventing the entry of food into the nasopharynx. So movement of bolus into the nasopharynx from pharynx is prevented by elevation of soft palate along with its extension known as vulva. Now the third and the last one, the forward into larynx. So for larynx, obviously we know a very important structure which is present, that is known as epiglottis. So there will be backward movement of epiglottis to seal the opening of larynx. Another thing, there will be a forward and upward movement of larynx will also be there, which will also prevent the movement of food from pharynx into the larynx or into the air passage. But sometimes this also happens, that sometimes the food get entered into this structure. So what happened in that scenario, in that case, we will also discuss. So basically, another thing, we have the deglutition apnea. So apnea refers to absence of breathing. A stands for absence of breathing. So deglutition apnea refers to the temporary arrest of breathing, in which there will be arrest of breathing during pharyngeal stage of deglutition, but this happens for very milliseconds. Okay, so basically the deglutition apnea occurs during this stage, but only for milliseconds. Now, another thing, we have the choking. So basically, what is choking? Choking is the inability to breathe due to obstruction or compression of respiratory passage. So whenever there will be entering of food inside the air passages, so that time the choking can be done, and sometime during the second stage of swallowing, solid food particles may even enter the larynx, resulting in obstruction and choking. So basically this is ultimately prevented by the gag reflex. So as I have told you that we will discuss the clinical case scenario, so that was relevant to this stage. So a patient present, just give me a minute. A patient present with difficulty swallowing and reports coughing and choking during meals. Which stage of swallowing is most likely affected? So, as we have discussed, the choking usually occur at what stage? Can you answer? You can answer in the message box also. Oral preparatory phase, oral transit phase, pharyngeal phase, or esophageal phase? Choking, they are asking. Giving you 30 seconds to answer. Yes, the answer is pharyngeal stage, obviously. Okay, now the final thing we have the entrance of bolus into esophagus. So obviously, uh, if the food is not going back into the oral cavity, not entering into the nasopharynx, even not in the larynx, so obviously there will be entering of food from pharynx into the esophagus. So since other three pathways are closed, the bolus has to pass only the esophagus, and this occurred by the combined effect of various factors. So upward movement of larynx stretching the opening of esophagus. Simultaneously, upper 3 to 4 centimeter of esophagus relaxes. So we know there some muscle fibers are present in the esophagus, and there is a series of wave contraction and relaxation also there, that is known as peristalsis. So this part of esophagus is formed by the cricopharyngeal muscles, and it is called the upper esophageal sphincter. At the same time, the peristaltic contractions start in the pharynx due to contraction of the pharyngeal muscles. Also, the elevation of larynx also lift the glottis away from the food uh, food passage. All the factors which they have mentioned in the slide also responsible for movement of food from pharynx into the esophagus. Okay, so again, I'm going to make a revision of this stage, that is pharyngeal stage. So basically, as we have discussed, that this stage shows involuntary complex, closely coordinated movement in the pharynx that pushes the bolus into the esophagus. And if we talk about the duration of this stage, so as we know that the duration is for 1 to 2 seconds. Now, talking about the movements that we have discussed in this stage. So the soft palate is elevated and thrown against the posterior pharyngeal wall to the close of the nasal cavity. This is prevents the food entry into the nasal cavity. The another thing we have discussed about the larynx. So as we know, the larynx rises with the elevation of hyoid bone. Vocal cords are approximated and breathing is momentarily inhibited. That is known as deglutition apnea. So epiglottis guards the laryngeal opening until the bolus reaches the esophagus. Another thing that we have discussed that about the choking, as we have discussed, the choking is the inability to breathe due to obstruction or compression of respiratory passage. And again, this has occurred in the second stage of swallowing, that is in pharyngeal stage. Now, talking about the third and the last stage of swallowing, that is the esophageal stage. Okay, so the esophagus is approx, as we know, it is 25 centimeter in length, right? And it is separated from the oral cavity by upper esophageal sphincter And in the lower, between the lower part of the esophagus and the stomach, we have the lower esophageal sphincter. Whenever both the sphincter are relaxed, so means at that time they both are open and there will be entry of food from pharynx into the esophagus, and from whenever the lower sphincter is relaxed, so there will be entry of food from esophagus into the stomach. So now talking about the basic morphology of upper and lower esophageal sphincter. So the upper esophageal sphincter, it is formed by the cricopharyngeal muscles, approximately 3 centimeter in length and covering upper part of the esophagus, right? And again, it is completely under the control of 10th cranial nerve, that is vagus nerve. It is normally shut off from the pharynx, thereby preventing swallowing of air during respiration also. This is the basic features and morphology of upper esophageal sphincter. Now talking about the lower esophageal sphincter. So basically this last, the length is approximately of 2.5 centimeter. And at rest, it is in a state of tone and its walls are tightly in a position. And again, its activity is also under the control of 10th cranial nerve, that is vagus nerve. Now, talking about the esophageal stage and what is the basic function and basic significance of both the sphincter. Now we're going to discuss in detail. Now, as we again know that esophageal stage is also involuntary. Okay, involuntary in nature. Now, what happened in this stage? In this stage, food from esophagus again enter into the stomach. Now, esophagus forms the passage for movement of bolus from pharynx into the stomach. The movement of esophagus are specifically organized for this function, and the movement is known as peristalsis. So as we have discussed, what is peristalsis? Peristalsis is a series of a wave in which there will be contraction and relaxation of the muscle fibers so that the movement of food will be regulated. So what is peristalsis? Peristalsis means a wave of contraction followed by the wave of relaxation of muscle fibers of GI tract, which travel in a anterograde direction, or we can call in the downward direction. So by this type of movement, the content are propelled down along the GI tract. So what happened when the bolus reaches the esophagus? The peristaltic waves are initiated, right? But here we're going to discuss two type of peristalsis. The first we have the primary peristalsis contraction, and the second we have secondary peristalsis contraction. Now, basically, what is the basic difference between both the primary esophageal peristalsis and the secondary peristaltic contraction? So, basically, the primary one is initiated by swallowing and begins when the food passes into the esophagus from the pharyngeal cavity. So, the peristalsis, the primary one, always initiated when the food enters into the upper part of esophagus. So if we consider this as the esophagus, this is the upper part and this is the lower part. So the primary peristaltic contraction always begin when the food is in the upper part of the esophagus. Right, and again it is coordinated by the vagal fibers that is originated from the swallowing center within the medulla. So which is the swallowing center? It is medulla. Now the next we have secondary. So as we have discussed, the primary peristaltic contraction are always in reaction whenever the food is present in the upper part of the esophagus. So obviously the secondary will be belonging to the lower part of the esophagus. So it is initiated by the presence of food within the esophagus after primary peristalsis is completed. So whenever the food is propelled down from upper part towards the lower part, the secondary peristaltic contraction will be initiated. And whenever the primary one will complete it, only then the secondary one will start it. And it is due to the stimulation of mechanical receptors, which are again present in the esophagus. and it is coordinated by the intrinsic nervous system of the esophagus. So, as we have discussed that what is primary peristaltic contraction? So whenever the bolus reaches the upper part of the esophagus, the primary peristalsis will start, and after origin, the peristaltic contraction passes down through the rest of the esophagus, propelling the bolus towards the stomach. Pressure developed during the primary peristaltic contraction is important to propel the bolus deep inside the esophagus initially. So basically, there are two types of pressure which develop inside the esophagus. The first we have the negative and second positive. So initially, the negative pressure always develop inside the esophagus during primary peristaltic contraction. And why this happens? This happens due to the stretching of the closed esophagus by elevation of the larynx. But as the food moves downward from upper part towards the lower part, that negative pressure will convert into the positive pressure ultimately. Now, what is secondary peristaltic contraction? Yes. Am I audible now? Yes. So if the primary peristaltic contraction are enabled to propel the bolus into the stomach, the secondary peristaltic contraction appear and pushes the bolus into the stomach. Secondary peristaltic contraction are induced by the distension of upper esophagus by the bolus. After origin, these contraction pass down like the primary contraction and produces a positive pressure. And another thing also happen in the secondary peristaltic contraction, that there will be relaxation of the lower esophageal sphincter, so that the sphincter open and the food will push down itself into the stomach. Okay. Now another thing, we have the deglutition reflex. So though the beginning of swallowing is, as we know, it is a voluntary act. So later it become involuntary and it is carried out by the reflex action that is known as deglutition reflex. It occurs during pharyngeal and esophageal stages, because both the stages are involuntary. The stimulus is when the bolus enter the oropharyngeal region, the receptor present in this region are stimulated, and this reflex also initiated. Afferent fibers, the afferent impulse from the oropharyngeal receptors pass through the glossopharyngeal nerve to the deglutition center. And we know that deglutition center is present in the medulla. Now the center is present in the fourth ventricle in the medulla oblongata of the brain, and the efferent fibers, the impulses from the deglutition center travel through the glossopharyngeal and vagus nerve, that is parasympathetic motor fibers, and reach soft palate, pharynx, and esophagus. The glossopharyngeal nerve is concerned with pharyngeal stage of swallowing. The vagus nerve is concerned with esophageal stage. Now, discussing the some applied physiology, but before discussing the applied physiology, I'm having some questions to discuss with you. Okay, so I'm going to ask some questions with you. So, okay, so basically the question is, which is the proper order of structure that food must pass through on its way to stomach? The option is mouth, oropharynx, esophagus, and stomach. The second option is mouth, laryngopharynx, oropharynx, nasopharynx, and stomach. Please answer. First option is mouth, oropharynx, esophagus, stomach. The second is mouth, laryngopharynx, oropharynx, nasopharynx, and stomach. Yes, the answer is first one, mouth, oropharynx, esophagus, and stomach, because there is no relation of swallowing with nasopharynx. So that's why the option first is correct. Now, discussing some applied physiology. So, first we have dysphagia. So, as we know, dys means difficulty, right? And phagia means swallowing. So, dysphagia means the difficulty in swallowing. So, it may occur due to disorder that is involved in any stage of swallowing, and it could be due to mechanical obstruction of esophagus due to presence of any tumor or structure, narrowing of tubular structures also, and it could be also due to decreased movement of esophagus due to neurological disorders such as Parkinson's. Then it could be due to also muscular disorders that lead to difficulty in swallowing during oral stage also. Then next we have esophageal. Just give me a minute. So esophageal achalasia is a neuromuscular disease which is characterized by the accumulation of food substances inside the esophagus and which also prevents normal swallowing. So with this applied physiology, we have completed two disorders. Then we have the GERD. So, as we know, GERD means gastroesophageal reflux disease. It is a disorder that is characterized by the regurgitation of acidic gastric content through esophagus, and this is could be due to the weakness or incompetence, failure of constrict of cardiac sphincters. Also, the another features could be due to dysphagia, cough and change of voice, due to heartburn, inflammation of esophagus. Also, then we have tracheoesophageal fistula. So basically, this is a this is a congenital defect that is characterized by abnormal connection between trachea and esophagus. Air can pass through the fistula and enter GI tract, resulting in distension of intestine. Also, liquids taken by the baby may enter the lungs, causing pneumonia and breathing problem also. So tracheoesophageal fistula is often associated with esophageal astrasia also, and atrasia is another congenital defects in which the esophagus is shortened and close of forming a blind pouch at any level along its length. So we have also covered four disorders that is related with this stages of swallowing. Now I'm going to give you a very a brief summary of the stages of swallowing. So first we have the oral stage. So as we have discussed, the oral stage of deglutition is voluntary stage, and in this stage the bolus move from mouth into the pharynx by means of series of action. So as we have discussed, what will happen? The bolus is placed over the posterior dorsal surface of the tongue, and this position is known as preparatory position. Then the anterior part of tongue is retracted and depressed. The posterior part of tongue is elevated and retracted against the hard palate. This pushes the bolus backward into the pharynx. The next stage we have the pharyngeal stage. Again, this is the involuntary stage. In this stage, the food is pushed from pharynx into the esophagus. As we know that pharynx is a common passage for both food and air. It divides into larynx and esophagus. The larynx lies anteriorly and continuous as respiratory passage, and esophagus lies behind the larynx and continues as GI tract. since pharynx communicate with mouth, nose, and larynx and esophagus, so during this stage of deglutition, bolus can move or can enter from pharynx into the mouth, into the nasopharynx, or into the larynx, or it can also enter into the esophagus. Now, what are the structure that prevent the movement of food into the nasal cavity, into the larynx, or into the mouth, that we're going to discuss. Um, so back into the mouth, the return of bolus back into the mouth is prevented by position of tongue against the hard palate and high intraoral pressure that is developed by the movement of tongue. In the second thing, that upward into the nasopharynx, so there will be movement of bolus into the nasopharynx from pharynx is prevented by elevation of soft palate along with its extension known as uvula. Then forward into the larynx is prevented by the very important structure that is known as epiglottis. So there will be backward movement of epiglottis to seal the opening of larynx. Then finally, there will be entrance of food into the esophagus. So since three other parts are closed, so there will be movement of food or bolus from pharynx into the esophagus, and there will be upward movement of larynx that stretches the opening of esophagus, and simultaneously upper 3 to 4 centimeter of esophagus relaxes, and this part of esophagus is formed by the some muscles. So at the same time, peristaltic contractions start in the pharynx. Due to the contraction, finally the food will propel down into the esophagus. Now the third stage and the last stage, we have esophageal stage. So again, we know the esophageal stage is involuntary in nature, and in this stage there will be movement of food from esophagus into the stomach. And again, a very important movement that is known as peristalsis, that basically starts in this final stage of swallowing, which will help in the movement of food from esophagus to the stomach. So this is all about the stages of deglutition and swallowing. So thank you so much.